Have you ever wondered how does a nurse do his or her job even in community settings? Well, guess what? You're here for a treat because for this video, I will be discussing the bag technique. So, the bag technique. The bag technique is actually a tool making use of a public health bag or the CHN bag through which a nurse during his or her home visit can perform nursing procedure with ease in deafness, saving time and effort with the end in view of rendering effective nursing care. So, additionally, the nurse's bag is actually a vehicle uh, for carrying the tools needed during a home visit, which we will discuss later on. So also the public health nurse bag is designed to carry equipment and material during a visit to the home, school, and factory. Lastly, equipment and material are needed to make tests and demonstrate patient care, such as eye irrigation, ointment and medication, urine testing, and etc. So, knowing the basic definition of the bug technique, we can now then identify the purpose of it. And actually, it is more defined and standardized of these three core principles. So, it is as follows. First, performing the bug technique will minimize, if not prevent, the spread of any infection. The second one, it saves time and effort in the performance of nursing procedure as discussed earlier. And lastly, the bug technique can be performed in variety of ways depending on the agency policy, meaning the CHN bug or the purpose of the CHN bug can be subjectified with the policy of the agency. The CHN bug should be generalized or to be suitable to suit everyone's need, the home situation, or as long as the principle of avoiding transfer of infection is always observed. So take note of this one. Principle of avoiding transfer of infection is always observed. It is our duty as a public health nurse to further reduce the risk of compromising the health of our patient, meaning the community, and infectious diseases. So, let's go to the albumin test. This test is actually measures the amount of protein albumin in your blood. Additionally, the liver makes albumin. So, technically, the generalization of this infection is that if there's an irregularity or abnormality, it means there is a problem in the liver. And so, albumin carries substances such as hormones, medicines, and enzyme throughout the body. And so, this test actually helps to diagnose, evaluate, and watch kidney and liver condition as stated earlier. So, kidney and liver condition. When the kidney starts to fail, albumin starts to leak in your urine. So, urinalysis. Um, Furthermore, this causes a low albumin level in your blood. Lastly, results are given in grams per deciliter, and then the normal range of the albumin is around 3.4 to 5.4 grams per deciliter. So any irregularities or any lower than 3.4 or any higher than 5.4 can be fatal for us. So, in generalizing or in assessing, if there's a low albumin level, it means the patient may have malnutrition. It can also mean that the patient will have or has a liver disease or an inflammatory disease. In the opposite end, the higher albumin levels may be caused by acute infections, burn, stress from surgery, or even heart attack. Lastly, for our discussion, the glucose in the urine test or urine test for sugar measures the amount of glucose in your urine. Glucose is actually a sugar. Um, and then the hormone insulin helps move glucose from your bloodstream to your cell. If too much glucose gets into the blood, the extra glucose will be eliminated through urine. and urine glucose test can be used to help determine if the blood glucose levels are too high, meaning it may have a sign for diabetes. So, collectively, the albumin test and then the urine test for sugar can be used to further explain or to further assess the patient of kidney, liver, and collectively for diabetes. So, the CHN bag looks like this. It is basically a basic bag actually, but it's consisting of everything that we need, from vials to gloves to gauze pads to sutures or even syringes. It is located inside. So the CHN bag, as we've discussed earlier, focuses on the efficiency of nursing intervention. So it is expected to contain all of the necessary or essential for us nurses. So, upon arrival at the patient's home, place the bag on the table, lined with a clean paper or plastic sheet. The clean side must be out and then the folded part touching the table. The rationale of this one is to protect the bag from getting contaminated. So, before before placing the bag on the surface, we need to cover it with plastic cover. So, open the bag. Put out the plastic cover. And then make sure that the folded part or the outside part will be touching the table. So that we can now put our CHN bag inside or on the top of the plastic cover. So that you can arrange it. Next, if thorough or if running water is not available on the home, it is best for us to ask for a basin of water in order to use for hand washing. So after that, we need to open the bag, and then take out the towel and then the soap. The soap actually be contained with this container in order to be organized, of course, because we actually want our CHN bag to be organized and then clean. And then once open, the soap and then the alcohol. Alcohol is advisable to be at 70%, not just 30%, in order for us to ensure the safety or to eradicate the microbes on our hands. So we'll put it in this way, and after that, we need to actually pull out our gloves also. And then proceed to hand washing. So, after thorough hand washing, we need to take out our apron and then wear it in order for us to be ensured of our safety as we do the laboratory procedures. There you go. So, for our albumin test, the first step would be filling up the 3/4 of our test tube with urine sample, uncontaminated urine sample. After that, we need to lead actually the alcohol lamp, but sadly, I do not have such equipment. So, after that, we need to heat up the top part of the test tube. So, after it, when it boils, observe for any changes and cloudiness that may occur. So, if there, in our situation, there's no cloudiness and whatsoever, meaning the urine is negative for albumin test. Proceed to next test. But if there's a cloudiness, we may need to administer acetic acid in order to remove phosphates and
redo the experimentation, and after that, if cloudiness still occurs, then the urine is positive for albumin. If acetic acid removes the phosphate, and then the cloudiness is removed, the urine is now negative for the albumin. Next, experimentation. And for our last test, the urine test for sugar, we need to actually have a Benedict solution. This one. So, we need 5 ml of the Benedict solution. In my case, I put the Benedict solution in a 5 ml or 5 cc syringe, and then to be administered efficiently or easily on our test tube. After that, this one. And then we need to actually have 7 drops, only 7 drops of the urine. So, 1, 2, 3, 4, 5, 6, 7. 7 drops. And after that, we need to heat up our test tube again. So, we need to actually observe the color changes of the of our sample here. So when it boils, if there's an abnormality or there's a change, it is we can assess it through its color. So if no change, then 0, blue, and then green, and then the yellow, and then the brick red. It actually signifies that you have either a normal level of glucose in your body, or the glucose is not being secreted through your urine. And while on the brick red side, it basically means that you have a large amount or an excess glucose, and you may, or the patient may or may not have diabetes. So so for the albumin test, we need to actually observe for the cloudiness, while on the glucose test, we need to actually see or observe the color change on our sample. So after that, after everything, after you discard the sample, we need to actually clean everything that we've used. So for my case, I will use an unused vial, and then put all of the sample there in order for me to not spread the contamination or the infection, or to stop the infection or the spreading of the infection. After that, we need to go back to our basin, or on my case, I have running water, so in order for me to clean everything, and then after that, discard everything. So after everything has been cleaned, we need to do thorough hand washing also. So we need to discard our gloves, put it on our plastic bag, make sure that it could be secured, along with other laboratory equipments, or the disposable ones that we've used. So, and then proceed to thorough hand washing. After thorough hand washing, our hands is now cleaned. We need to actually put everything back into its place. So we need to open our bag again. And then put everything into its places. We need to make sure that our CHN bag is clean and then sanitized, in order for us to have efficient and effective nursing interventions. And we need to actually take off our apron and put it inside also. Again, um, the um, the folded part should be on the outside, and then the inward should be facing our direction. And close the bag. So after everything has been cleaned, our discarded in order for us to put our discarded laboratory equipments inside our station bag, we need to actually here's what I thought. So first we need to carry the bag and fold just like we used to unfold earlier, and then put it inside like that, and fold it again in order to fit our station bag. And open the bag again. So, and then finally, close the bag. And finally, close the bag. After we've closed it, put it on the side, clean. Make sure that the table will also be cleaned and free from any infections or reagents that we've used earlier. After giving nursing interventions, whatever nursing interventions it may be, we need to monitor, interview, and evaluate our patients in order for us to know the effectivity of our nursing interventions, and also devise or to revise or to formulate new strategies for the next home visit. And that's how we do bag technique. Once again, I am Corbin Janes Bangsal, Bachelor of Science in Nursing, second year, section 2. That's all. Thank you.